Go ahead, James.
Good morning. Welcome everyone to the first session of the Kidney Foundation's virtual symposium. This morning's session is on COVID, managing the risks of the new normal. My name is James Bellamy, and I'll be your moderator for this session. I am the director of the renal program at Grand River Hospital. I'm also the regional director for the Ontario Renal Network in the Waterloo-Wellington region. I am the current chair for the dialysis technical committee for the Canadian Standards Association, and I really do have a strong passion for kidney care. My work through kidney care has really spanned almost 3 decades now in healthcare throughout the full continuum of renal care. It really originated back with my formal background in engineering, where I then transitioned into clinical studies and then further into business studies. Just a friendly reminder that if you'd like to submit any questions for any of our speakers during the session, to please write them in the Q&A box. All these questions will be answered at the end during the Q&A portion of the session. It is now my pleasure to introduce everyone to our first speaker, Vidya Namkusang. Vidya is a medical laboratory technologist with a background with nearly 11 years experience working in microbiology laboratory. She started as an infection control practitioner in 2001 at North York General Hospital, working primarily in acute care, but also in the rehabilitation and long-term care settings. In 2004, Vidya moved to the University Health Network, where she had an opportunity to work on the infection control resource team, lead UHN's external consulting, and became a team leader in the infection prevention and control department at Toronto General Hospital. She has been with Scarborough Health Network since 2010 as the manager of infection prevention and control, an executive member of the IPAC GTA, which is the local chapter of the IPAC Canada, as the administrator and president. Vidya is certified by the Certification Board for Infection Control and Epidemiology since 2004. She also served on the Provincial Infectious Disease Advisory Committee from 2016 to 2021. This committee advises Public Health Ontario on matters related to infection prevention and control. Over to you.
Thank you so much, and I'm so honored to be here and happy to be here for the first session of your day. Hopefully I can provide you with some great information that you can take forward. So I'm going to cover COVID. I'm going to speak about COVID-19, but I think it's really important that we kind of focus on globally what's happening so that we have an idea of how that impacts us, and then kind of go into what's happening in Canada and specifically Ontario. I'm going to talk a little bit about the changing public health measures and recommendations, and about how to protect ourselves and others. So this is a bit of a busy slide. It comes from the World Health Organization, and it's updated up to March the 13th of 2022. So as you can see, this is a slide that shows the number of cases of COVID worldwide. Now, these are reported cases that have happened. And
sorry to interrupt. Yeah, your slideshow's not moving forwarding.
It's not moving forward?
No. You have to put it on presenter mode. We can't see that.
Sorry, say again.
But you have to put it on presenter mode.
Yeah, I thought I had. Okay, hold on.
Sorry, I think
it is on presenter mode from my end. Let me try again.
You're sharing you're sharing the PowerPoint and not the presentation. That's all. Stop sharing and reshare.
Oh, I think I did it again. Hold on. Sorry for the technical difficulty. I thought I had this figured out. Okay, tell me what you see and if it's presenter mode or not.
No, that's still your, oh, there you go, Vidya, that's excellent.
Perfect.
Okay, thank you so much. Okay, I'm going to start over with this slide then. So the World Health Organization publishes data on global rates of COVID-19. So the graph that's on the right here shows you data up to March the 13th. I don't know if you can see it very well, but at the very end of the graph on the right, there is a slight increase that you can see. Now, that is an 8% increase that has happened up to March the 13th. So we had a steady decline, and then in the last couple of weeks, we're seeing an increase. The increase was in and around 8%. The highest numbers of cases that were reported in Korea, Vietnam, Germany, Netherlands, and France. Now, keep in mind that every country has different types of testing policies and procedures. So there's a likelihood that the numbers that you're seeing on the graph are underreported because not everyone tests all patients that come through and all people in the community. So for instance, in the UK, they test almost 100% of people that need to be tested. Here in Canada, we've actually had to pull back, especially in Ontario, so that we didn't overwhelm our lab system. So there's only a sector of people that are currently being tested in an region, going to assessment centers and being allowed to be tested. So this graph here shows you the prevalence of COVID right now up until March the 13th. And anything that is in terms of what you consider to be a high rate of COVID, 100 per 100,000 or higher is considered to be high. So anything that is like the darker browns in this whole graph, it would be considered. So right now it's looking as though Canada is not high. We're between 50 and 100. I can speak a little bit more about what's happening locally, but this kind of gives you an idea of what's happening. In Europe, there's been a significant increase over the last little while, and a lot of this has to do with the variant that's currently circulating, which we can talk a little bit more about later. So I think it's important to think about, like, these are words that I never thought would be mainstream in the media, and yet they are. So I figured maybe we could go through them so that to help people have a better understanding of what they mean. So when something is considered to be endemic, it refers to the constant presence and or usual prevalence of a disease or an infectious agent in a population within a geographic area. So I can give you an example that's not COVID related. So something like tuberculosis in India is endemic. So it's within a specific geographic population, and it's there present all the time. An epidemic is when there's a sudden rise or a sudden increase in something that's not expected in that population. And then if an epidemic worsens across the globe, it then becomes a pandemic. There's a lot of thought in the science world right now that COVID-19 will become endemic, but we're not quite at that point where it is endemic. We're still considered to be in a pandemic. So there's a lot of different things that are looked at when we're deciding what is the community prevalence, how much COVID-19 is out there, how careful do we need to be, can we make decisions about, reducing, public health measures, etc. So some of the things that are considered, I have here on the screen. So the percent of tests that are positive for COVID-19. So you have a lot of assessment centers out there. So they look at the percent of positive tests that are positive. So I would say middle of January, 34% of the tests that were done were positive, and now we're at the point where it's about 13% at the tests that are positive, and this is in Ontario, which is good, but anything above 5 is considered high, so we are still high. In terms of COVID-19 hospitalizations, this is another indicator. This really helps to determine how it's impacting the healthcare system. We've seen a 81% decrease since the middle of January for hospitalizations, and a 77% decrease for ICU-related admissions, which is all great news. We also look at something called COVID-19 in wastewater. So they look to see how much COVID-19 is in the wastewater. And basically what we have seen over the last little while is we saw a decrease from January, then a plateau, and then within the last couple of weeks, we've seen a bit of an increase. And then when we talk about overall trends, one of the countries that we compare ourselves to regularly is the UK. And the reason we do this is because it's a developed country. They have similar policies and procedures with regards to public health measures that we've implemented, and they have similar vaccination rates. So often we would look at what's happening in the UK, and then what happens in Canada often happens between 10 and 14 days after. So what is the risk of getting COVID-19? So this really does vary between and within communities. It's dependent on many things, including how many people are vaccinated in that community, the level of COVID-19 activity in the community, including what is the variant of concern, and how well you and others follow their local public health measures. Other things to consider. So there are people that are more at risk of severe disease or outcomes, including those with kidney disease. There's a whole other list of patients included here. It's important to note that it's significantly higher risk for people who are not fully vaccinated, those of any age who are considered to be immunocompromised. And there's actually a whole definition of what immunocompromised means, and it's really not a simple one. And then those living with obesity. So this slide I actually really like because it really does sort of help to describe where we're at, especially now. So when COVID-19 happened a couple of years ago, the government had to consider a lot of control measures. And the reason they had to do these control measures, the main goal was to not overwhelm the healthcare system so that we could manage our patients and take care of the public. So we did lockdown measures, we did masks, we did physical distancing, we encouraged vaccination, and we had vaccine passports. This was all to balance with healthcare and, you know, manage the severe disease and deaths. And all of this came at the cost of our mental health, our personal freedoms, and the economy. So, you know, we're in a different place 2 years later, where now the government is feeling like the numbers are low enough that we can safely start to reopen and do our lives can go back to somewhat normal lives. So in terms of public health measures, we all know that they are being lifted in the community, and community is written in capital letters because it hasn't really changed with regards to healthcare, but it has changed with regards to the community. So we have no more outdoor capacity limits. Even indoor capacity limits are either increased or full in terms of what they'll allow. There's been a removal of masks just this week in public indoor settings, and a lot of the mandatory vaccination policies have been revoked. In Ontario, we will continue to mask for some time on public transit, congregate settings such as long-term care homes, jails, and shelters. And the go live date to sort of drop masks in those areas will be April 27th. Keep in mind that our community rates are still high. When I talked about the percent positivity in our assessment centers, it's still at 13%, so still high. And infection prevention and control measures in hospital settings will continue to remain up until that time, April 27th. So this slide I really like because it really shows you that there's so many interventions that need to happen to control COVID-19. So this is the hierarchy of control. So at the top, you can see the thing that has the biggest bang for your buck to eliminate the disease as much as possible. And that is actually, in the setting of COVID-19, it's actually vaccination. Vaccination has had the greatest impact. And of course, there's other things like paid sick leave, which allows you to stay home if you have symptoms of COVID, not go into work, and not get anyone else sick. Another example of one of these hierarchy of controls is an engineering control, which would be your ventilation. So you always want to be in a good ventilated space. You have a bit less chance of getting COVID if your ventilation is good. You can see in the community, they've added all kinds of HEPA units and stuff in schools to try to enhance the ventilation. What some of the administrative controls include physical distancing and hand hygiene. And at the very bottom there, you know, people think masks are, you know, the most important, and they are very important, but they're not the most important. They're actually at the bottom of the hierarchy. So there's multiple different things we can do to control COVID-19. Well, how do we protect ourselves and others? So with vaccination being at the top of that list, getting vaccinated is very, very important. At the point where we're at now, you know, with the community rate still being high, if we wanted to have an extra layer of protection, we would continue to wear our mask in public indoor spaces, as long as that level of COVID in the community is still considered to be high. We could still continue to do our physical distancing. We would avoid poorly ventilated and crowded spaces. So taking your gatherings outside is a great idea. The risk outside is much less than the risk inside. Cleaning your hands, covering your cough or sneeze, maintaining your bubble. So those that are around you, you know, we've been forced to be around 5 people, 10 people, only our household members for a lot of this pandemic. Just keeping it small, you know, and hanging around with the people that you know have the same thinking that you have around protection, like get the ones that are vaccinated. We always want to keep a clean home, and cleaning and disinfecting our surfaces that are high-touch surfaces in our home regularly is a great idea. We want to monitor our health, and we want to be alert for symptoms. So, of course, the main symptoms of COVID-19 being fever, cough, shortness of breath, but there are other symptoms. We want to adhere to public health measures for testing, isolation, and quarantine. And if we choose to travel, we want to do it in a safe way. When it comes to travel, I would suggest that you check the travel advisory on the Government of Canada website, because this gives you a lot of information on what's happening in different countries. It will inform whether you're making a good decision or not when you choose a place to travel to. I personally would also look at the WHO map and just take a glance and see, you know, where is COVID happening the worst right now, and where should I be avoiding, in addition to checking the Government of Canada website. So just in terms of vaccination, I'm showing this graph because basically the darker the green is, the more vaccinated people live in that country. So you can see that Canada, North America, we're well vaccinated. 11 billion doses have been given so far. So vaccines are generally safe with that amount of doses that have been given, and very few side effects. So the recommendation would be that all unvaccinated persons should start vaccination as soon as possible. Any adults who have had an mRNA vaccine during their primary COVID vaccination series should also receive a booster when available and when eligible. We all want to keep up to date on our vaccinations. Right now, a booster has been recommended for a lot of the population. There are 4th doses that have been recommended in certain settings, such as long-term care, but we don't know what's going to happen down the road. I mean, if COVID becomes endemic, it may become like influenza, where we may have to get vaccines on a regular basis. There's no way to tell where we're going to land with this, but that's one of the things that could happen. And when you have 3 doses, you're looking at 60% protection versus mild disease, and 90%, this is the most important part, I think, 90% protection versus hospitalization and severe illness. So at Scarborough Health Network, we actually have something called a VaxFax clinic. And this clinic has been up and running for several months now, and you have the ability to use the website, go in, make an appointment, and speak to an expert on vaccinations, and make the best decision that you can based on your own health. And I think that that's very important, to be able to speak to yourself personally and what your issues are and make the best decision for yourself. So I would encourage people from across the country have used this VaxFax clinic. So I would encourage those of you who may have questions to do the same. In terms of masks, I think this is an important point. So the morbidity and mortality weekly report from the CDC, this was one of the reports that they had. So they did a research study, and they concluded that the use of a face mask or a respirator in an indoor public setting was associated with a lower chance of acquiring COVID-19 infection. Protection was best seen amongst those who wore it all of the time. You need consistent use, especially in an indoor setting. It's very protective. When you're looking at infection, what was lowest among people who reported wearing certain types of masks. So there's a chart there on the left. So you can see wearing no mask obviously provides no protection. A cloth mask is at 56% decrease in your odds of getting COVID. A surgical mask or procedure mask would give you a 66% reduction, and then if you wore an N95 respirator or a KN95, you'd be at 83% lower risk of getting it. So it really helped to reinforce that masks are useful, and it really gives you a good idea of the kind of mask you might want to use. I just want to add that it's not only the kind of mask you're using, but the fit of the mask is crucially important. You want to have no space around. You want to be as close fitting to your face as you can possibly get it. In terms of testing, I just wanted to talk about this briefly. you know, there's PCR testing that can be done. There's also rapid antigen testing that's available more and more so in the community. And, you know, you can get kits all over. There's, you know, free kits that have been given out. So in terms of the rapid antigen test, this latest wave of COVID that we've had, it has been caused by Omicron. And Omicron is actually more transmissible and has been less able to be detected by a rapid antigen test. So the sensitivity and specificity of the rapid antigen test for Omicron was reduced. So we were looking at like something like 68% sensitivity with this wave. So you can increase that sensitivity by using a rapid test by doing your cheeks or your tongue and throat and then your nostrils. So that's one way to try to increase that sensitivity. If someone tests positive on a rapid antigen test, it's very specific. So a positive is a true positive, but a negative can't necessarily be considered to be a reliable test. You'd have to do consecutive days of testing with a rapid antigen test to ensure, because the way the Omicron especially worked is that if you were to test yourself on day 1 and 2, you are likely to have a negative test. You're most likely to have a positive test on day 4. But not everyone's testing every single day to know when that's going to happen. So a single negative rapid antigen test does not rule out COVID. And of course you have your PCR test, again, a word I never thought would be a household word, but it's very highly sensitive and highly specific, like high 90s. So that's always good as a backup. So in terms of the most recent projections, so the Ontario Science Table came out with these projections just late last week. We have seen that the COVID cases, the hospitalizations, and ICU occupancy have stopped declining. Given that the relaxation in the public health measures, and what we expect to see is an increase in transmission because of the relaxed measures. So we're probably going to be seeing an increase, and ICU occupancy and hospital admissions will likely increase over the next few weeks. The extent of this increase will depend on the number of close contacts we have, especially indoors with no masking, vaccination status, and the spread of the more transmissible BA2 subvariant. So speaking of BA2, I just wanted to just quickly say the variant that we just came out of this wave from is BA1, and BA2 is a sister variant. They're both Omicron. BA1 and BA2 are sister variants. BA2 is considered to be slightly more transmissible than BA1, and we are seeing slowly an increase in BA2 across different places. So I would say in Denmark, it's 80% of their cases that are BA2 at this point. The UK is in and around 50–60%, and here in Ontario, the last data that I heard, which was from the early March, was 25%. So we can see BA2 will probably likely increase in the community. So older adults, immunocompromised, unvaccinated patients are still susceptible to severe disease. So that's important. And the most important thing that we can do is get our vaccine. Thank you very much.
Great. That was fantastic. Oop, I'm going to mute you there, video. That was fantastic. Thank you very much for that information. I would like to introduce our second speaker, GAIL Burns. GAIL is the Program Director for the Nephrology Program at Halton Healthcare and a Leadership Regional Director for the Ontario Renal Network for the Mississauga-Halton-Lynn. GAIL is a registered nurse, holds a Bachelor of Nursing Studies from the University of Victoria, a Master's in Nursing from Athabasca University, an MBA from the University of Fredericton, and a Lean Black Belt from the Ontario OHA. Thank you, GAIL, for being here, and I would like to turn it over to you.
GAIL, you're muted.
Right. Yeah, I didn't like to do two things at once. I didn't want to unmute and pull it up. So can everybody see fine? Is it pulled up fine?
Yeah, that looks good.
Great. Thank you for the intro, James. And wow, Vidya, I have to say, even after 2 years of COVID, I learned an incredible amount from that presentation. So thank you. My introduction says one story, which is really my story about how I work, but my life is also embroiled in the kidney journey. I was brought up in a kidney household. My dad was a home dialysis patient in the 70s and was transplanted. I have Alport's. I'm a stage 3 kidney patient, and I have a son who is progressing towards kidney failure, stage 4 or 5 right now. So really, you know, kidney disease is in my blood, and it really is a pleasure to be able to talk to you today about this topic, which I think is so timely. One of the things that, you know, I've talked about for 2 years is really COVID, and now as well as we move to our new normal, what does that look like and what does that mean to you? I'm trying to get this to advance. There we go. So some tips to help you go back to work in person, to travel, to grocery shop while keeping yourself safe. I think the thing here really to understand is as the community opens up to normal, we are going to struggle with the fact that kidney disease patients and patients who are in our renal communities may not be able to move to that normal quite as easily. Social interactions are going to be a bit challenging. And one of the things I even noticed with our population as a whole is moving to this whole new normal creates a fair bit of anxiety. This week in Ontario, we were allowed to take our masks off and do some activities. And it's interesting to hear the general comments out in the community about how uncomfortable that is making people feel. And people with conditions like kidney disease and immunocompromised patients will feel very vulnerable and will have a harder time with this because it isn't as simple for them. I mean, it's not as simple for them, and it's also not always easy. We really need to understand, and I love this quote, that we're all weathering that same storm, which is COVID, and how we manage it, but we're doing it in very different boats. And what I mean by that is people will be finding different strategies to manage that and different ways that they're able to move forward in a world that doesn't have COVID restrictions. So how can you navigate that world? Because it feels like the community was protecting everybody. The government had put these mandates in place. We were expected to wear masks. There were social distancing restrictions. There was a lot out there that was actually protecting the general population. And as that is removed, how do you take the steps you need to be able to protect yourself, but also maintain some kind of normal? With COVID, there is a real balancing act trying to figure out what's true danger for you and what's reasonable risk that you have to take to live a real life. And as that happens, you may see that you're taking steps that could lead you to feel greater isolation. You may decide that you're not out in the community feeling safe. It's common that people will withdraw, and anxiety and frustration around that is very normal. And I want you to understand that going forward, you are going to feel those things. And it's important that you understand those are normal feelings and there's ways that you can manage them. So it is completely normal to feel that worry. It can take some time to really adjust. And one of the things as healthcare providers that we always say is your family physician or your care provider will help you with that. Do not feel like you cannot reach out to them and get suggestions, because they are able to actually support your everyday life and what you're doing out in the community. And as a healthcare leader in an organization, we really look at how do we protect you within our walls. And we want you to understand that it's okay for you to continue to wear your mask and take other precautions if you want to feel safer out in the community and within our environment. You can choose to use whatever precautions you're comfortable with. Just because people out in the community aren't using them doesn't mean that you have to change what you're doing and what you're comfortable with. So the CDC has some recommendations, and Vidya went through some of these, but I think they're important to reinforce. And the thing that I always say to people is when you're assessing your risk, take a look at these pieces and then decide what level of protection you need to provide yourself. So for instance, with my family, we are at higher risk because of our kidney disease. So I go through this list and I say, are we vaccinated? Yes. Can we wear a mask? Yes. Are we in a situation that we can stay 6 feet away from others? And if we aren't, then what level of protection do I want to put in place if I want to do that activity? Avoid poorly ventilated spaces and crowds. So I'm going to use the example of, what if you need to use public transit? Going through this list, you would know that that is a poorly ventilated space with crowds. So you would want to take additional measures to make sure you're safe in that environment that somebody else might not need to take who is there, because you're now responsible for that protection for yourself. Wash your hands often. And I can't stress this enough. There are so many simple things that you can do. They're not always easy, but they are simple. So make sure that you're continuing to touch those points and stay on the pieces that really, will provide you the biggest bang for your buck. So cover your coughs and sneezes, clean and disinfect your area, and monitor your health daily. Now, what about virtual appointments? And I get a lot of questions about this. Am I going to continue to be able to have my appointments at home? What is that going to look like? Well, yes, according to a recent survey conducted for Canada, physicians are going to continue to do this. They are going to want to continue to have this ability for you to do this out in your communities and be able to do it from the comfort of your home. 64% say they'll maintain or increase that use. But remember, there's certain appointments that you can't do unless you're in person, and these include physical tests, vaccines, some specialist referrals, and some clinical treatments. And you may actually prefer to see your doctor and those people in person, and that's okay too. Your in-person visit should be an option for you. So don't feel like if you're asked to do a virtual visit that you can't request the opportunity to come and do a visit in person. There's valuable advancements that are being made. It's interesting to see what's going into the future for this. And one of the things that you can actually see coming is virtual testing, other options out in the community, and wearable devices that you're going to be able to get the information from your home to your healthcare provider. So how do you make best use of your virtual visit? You want to be prepared for your visit. So you want to make the most of the time with your doctor. Make sure you have your med list ready. Make sure you have the bottles right there. And that's one of the things that I always recommend, is so you can just pick it up and have a look at it. And actually, if you're doing virtual with video, often show your physician exactly what it is. Make a list of your questions for them so that you have that and you're able to get through it. Write them all down, have a pen and paper ready, and know your numbers. Like, really understand when you're coming to that visit that you want to come prepared. You're going to need your weight, you're going to need your blood pressure, you're going to need the other information for your physician to be able to provide you with the best visit. So what about COVID fatigue? So really, there's a lot of discussion about this, and there's two types of fatigue we really focus on. One is pandemic fatigue, and that's just being really sick and tired of having COVID around at all. And the other is the COVID fatigue that people who have been positive will feel afterwards. And they're two very different things. However, it's important to understand that both are real, that the way to get out of this fatigue is the same system, is really to set these small achievable goals that can enhance your wellness and make you feel like you can move forward with your options for keeping active, eating well, and seek out innovative ways to connect with each other. Lost my slides, apologize. So one of the ways that you can do that is by reaching out to things like the Kidney Foundation, excuse me, virtual visits, through some of the, I'm going to share, I'm going to discontinue my share and start again. Because for some reason it has stopped presenting. I apologize. So Sadia, I've lost my video completely.
Okay, I will share it on your behalf. 1 second. You're leave on this slide. Sorry, 1 second. Okay, go ahead, Gil.
All right. Click through.
Yes.
Okay, so thank you. So some of the innovative ways to connect is your Kidney Foundation support groups. One of the things I love is some interactive online discussion groups or book clubs that are available now. So you can reach out. Some of them you can find on Facebook. You can find other ways to connect through Google searches. Find an outdoor activity partner. And this is one of the things we as a family really did, was find somebody to go out and have that once a week time out in open air where you're not worried about social distancing as much. The other thing is that you can start a virtual habit like a weekly online lunch date with a friend. And there's lots of platforms to do that: FaceTime, Google Duo, Skype, and Zoom. There's also live online exercise classes, which I think we're going to see later, which is exciting, or take an online course. And online courses are available. There's many platforms for that. If there's Udemy, who offers it for free. You can go to your local colleges often and take online courses for free as an auditor. So look at those options. Okay, next slide. So different expectations pre-COVID and now. So one of the things that I love is this comment from the United Nations Task Force, and really what they do is when they are looking for improving after a disaster, they create a recovery plan, and their recovery plan always talks about build back better. So when you're living in your new normal after COVID-19, you almost require your own recovery plan. And how can you build back to better, not just back to normal? And many ways of doing that we've mentioned here, and you're going to see throughout this day, is really how can you take the things that you were doing before that changed during COVID and then build that back to a better system. And we've done that exact same thing in our hospitals. And our hospitals are incredibly safe places to come. We have made sure that that's what happens. Our infection control group calls it protecting our castle and the people in it. And you saw video's triangle slide, and really the triangle slide talks about, you know, the risk at that level, but within our hospital, we almost use the same thing, and we're trying to balance safety of our patients, safety of our staff members, and also the ability to have the visitors in so that we can do the psychosocial side of what we do with patient care. And it's a hospital's job to balance that. So what you're going to see in hospitals is that we may have different expectations about how you mask, what the expectations are for screening, than normal places out in the community have, because we are trying to protect our patients and keep them safe. And it's important that that be our priority. So you're going to see a different normal within your hospital system than you might see out in your community. And that's okay, because we're trying to keep you safe. We know that patients that come in to see us are vulnerable. We know that they have different challenges, and we want to make sure that we're doing our best to maintain that. And masking is one of the easiest ways for us to do that. And one of the things with masking, you know, I always like to point this out, and it's anecdotal, but isn't it crazy how we had such a decrease in the amount of colds and flu when we were masking for COVID? And you have to put some thought into that and thinking, how did that protect you differently? How did hand washing out there and not touching things and being cautious of that protect us in a very different way than we had been protected before? Okay, next slide. So one thing is that in our changing and learning world, there's never going to be a right answer for all. It's okay to do what's best for you. You need to take the time to enjoy your new normal. Use your healthcare people as information and strategies, and keep yourself safe and healthy. And one of my tips I give to all my patients, and we use it ourselves at home, is I've taken little Ziploc bags and I've thrown in a mask, some wipes, some hand sanitizer, and a bottle of water. And I have them in my car, and I have them at my front door in a little basket. And the reason for that is it makes it easy. I just grab it and I go. And the reason why, and everybody says, why a bottle of water? Because when you're out and you need a drink, a public fountain's not going to be your best option. So a little glass of water is great, or a little bottle of water. And it also helps because wearing masks is a bit of a pain, and it's always great to have that with you, and it just helps you be prepared. So you can find tips and tricks to create your own normal, and reach out to your healthcare providers, your social workers, your dietitians, your physician, your nurses, to ask them, you know, if they have strategies for this, because they're your best resource. I always laugh at people who say, you know, I've Googled it. Well, you know what? You guys are incredibly fortunate. You have a whole healthcare team here at your beck and call. You don't need to use Dr. Google. You can use your actual doctor. So next slide. So that's it. Any questions? Happy to take. Sorry about the issues with the slides, but I think we got our main points across and really happy to take any questions.
Great. Well, thank you very much, Gail and Vidya, for these insightful presentations. So absolutely, as you pointed out, would be a great time now to take some questions from the audience. So if you'd want to submit your questions in the Q&A bubble box there, please do so. And please remember that we're only able to answer from a general perspective, and we won't be able to provide specific medical advice. So please reach out to your own medical team and your hospital for questions about your own personal health care or further information about COVID. So let's go back to our questions here. Question number 1. Oops, I am on the screen. There we go. Can we get an update on Health Canada approval of Evusheld prophylactic antibodies for immune suppressed renal transplant recipients? I'm going to try and lean that one maybe to Vidya.
I'm not an expert in that at all, so I'm not sure I can answer that.
Okay. So I'm thinking that one we're going to have to park because I don't know if we're able to talk about the prophylactic antibodies there. Question number 2. Does layering multiple masks increase protection? I'm going to go back to Vidya.
Yes, you know, this has been something that I've seen in healthcare a lot. In healthcare, we have switched over a lot of our, in Ontario, there was a mandate that came down a few months ago, switching healthcare providers over to N95 respirators. What I've seen is a lot of double layering of masks. Now, I think that the mask itself provides the protection, and I would not recommend layering them. It is very difficult to breathe and get through a day on top of that with a double mask on your face. I don't even know how the healthcare providers do it. Wearing an N95 on its own is difficult enough, but to have another mask on top of that is very challenging. I would encourage you to, if you need to change your mask, change it on a regular basis, but not to wear 2 at the same time. They're meant to be worn on their own.
Great, thanks, Vidya. And on that note, is there any actual risk about having multiple masks because now you're touching your face more often?
There is that too. So if you're going to be changing your outside mask, thinking that maybe that's contaminated because it's on the outside, then you could be contaminating your inner mask as you put it on and off. So there's also that risk. Perfect,
thank you. Our next question says, how does the risk of hospitalization change for immunosuppressed patients who have had the same 3 vaccinations?
So I don't know the statistics on this. I can speak to what I've seen throughout the pandemic. So we were very vigilant at Scarborough Health Network with making sure that we offered vaccines to our, hemodialysis CKD populations. We did see every single wave we had, we saw cases in this population. And so I think at the end of the day, what we need to do is do as much as we can to protect ourselves, and getting vaccinated, we know works. Like I've seen so much evidence and so many charts on this that show you that even though mild disease is not necessarily prevented, especially with Omicron, it really prevents severe disease and it really prevents ICU admission and it really prevents death. And those are the most important things. So I would definitely say that we would encourage the vaccination, and you have an extra thing to worry about if you're immunocompromised. As per that list that I showed in my presentation, there are many people out there with those kinds of issues. And at the end of the day, the most important thing, going back to sort of the hierarchy of controls that I showed a little earlier, vaccination is your best option.
Great, yeah. And I think one of the things I've noticed on our end from a provincial standpoint is probably the COVID has had the most eyes on it and attention in terms of monitoring, doing some research and understanding effectiveness of public health. So I think this is going to produce some really good guidance and information going forward for how we handle other diseases. Question number 4. When you swab the cheeks, throat, and nose, is this done using the same swab or different swabs?
Actually, the same swab.
All right, great. So number 5 here. So when traveling, how can we stay protected assuming we are already vaccinated? So I think, Gail, you had some great tips on traveling there.
Sure. So, I mean, it's really about following the same tips that you use when you're out in the community. It's the social distancing if possible. It's decreasing the amount of close contact you have with people if you aren't able to social distance. I recently traveled, and one of our strategies was that we found a lounge away from the gate for where we were flying so that we were able to maintain that space. It's keep making sure you're hand washing, using hand wipe, like the sanitizing wipes, making sure you have your mask on and a good fitting mask. I always recommend when you travel, I think, you know, if you can get a hold of the N95 type mask, it is a better mask when you're in a risky situation. So if you can get those, and Vidya, I loved your chart about that. I think it really showed how different masks have different levels of protection, because I think there was a cloth mask question as well. And you're always better when you feel risk to find a mask that has a higher level of protection to wear if you can get it. And it's really about just making sure that you're taking the time to think about what the risks are and then thinking about what you can do to protect yourself. And it's not, as I said before, it's simple, but it's not easy. It's hand washing, it's mask wearing, it's distancing, it's really, you know, making sure your environment is as clean and safe as possible. And I don't know, Vidya, do you have anything to add?
Yes, so I also recently traveled, and one of the things I did was I picked a destination. I had to take a plane, but I was on the plane for not like a shorter period of time, and I thought this is just my comfort level. People can do as they wish. So for me, it was important to have a short flight where I did not have to remove my mask. I didn't have to drink. I didn't have to eat. It was less than 2-hour flight, and that actually made me feel more comfortable in that setting. And then, of course, just going back to some of the tips that I had before with just checking the area where you're going. Remember that cases are underreported. So if you're seeing the dark colors and it's likely underreported, the cases are likely much higher than that. So pick a place where you know there isn't, you know, a lot of high community transmission. That's what I would be doing at this time.
Great. And so on that same theme, talking about comfort and the opening of the different health precautions there. So how does one protect against COVID infection if I'm the only party member properly masked, but everybody else is unmasked and potentially infected? Any thoughts on that?
I don't know, Gail, do you want to comment? I was going to say that for me, I think it's surrounding myself with those that are, you know, conscious of my health conditions, how I feel, and are of the same mind. And, you know, we were forced to do this during previous waves where we could only see the 5 people in our household or up to 10 people at the most. And I would just continue to do that for the next, I'd say 2 weeks to a month. I think we'll know more about what's in store for us next in terms of community cases increasing, et cetera. And I think we can make different decisions when we have more information.
Right. And I also think, you know, we're shifting from a place where the masses are protecting us to us having to look at how do we protect ourselves. So it is about that. Is that environment does it make me feel safe? Am I wearing what I can and protecting myself, and, you know, weighing that risk against the benefit of being out doing that. So as hard as it is, I think great advice, Vidya, in the next few weeks, really, you know, do we want to be in those social situations yet until we know what that looks like? And it's always time proves where we need to go. And so maybe give yourself the grace of time and, you know, taking a little bit more time to be cautious.
Okay. So on that level of protection, the question came up about, should I get the 4th dose of vaccination since we're not fully compromised like transplant patients? Yes.
So I'm definitely not a vaccination expert, and but as I had said in my presentation, I would encourage you to get the vaccines that you're eligible for. This is a changing organism, so you can see we've had so many waves because there's been so many variants, and you know, it's not so much unlike the flu at this point, where every year you've got to get a different vaccine because it mutates every single year. So in order for us to continue to protect ourselves as we become eligible, I would encourage you to go ahead and get vaccinated. Myself and my entire family are vaccinated.
And I would suggest, if you have questions, reach out to your physician and your healthcare providers and ask them about the dosing and whether they think it would be, you know, valuable for you to get it based on your medical condition. I think, you know, our physicians at our hospital, and I'm at Halton Healthcare, have really encouraged patients to get their 4th dose when available, their 3rd when it was available as well, because the more protection you can get, the more you can get back to normal.
Yeah, and I'm always of the mind that we can, you know, there's so much we can't control. We should really take advantage of the things we can.
And I'm going to go back to my original statement to say this is a situation that's extremely well studied and very closely watched. And then that recommendation for the 4th dose wasn't widespread for the entire population. So this is really something that has been identified and looked at. So definitely take that in consideration when you're talking to your healthcare provider.
And I think, to your point, James, our nephrologists across the province have lobbied very hard with the government to have this option for patients because they feel it's valuable for our patient population. And, you know, they are the experts. I'm not a medical expert, but I truly believe when you have a large group of physicians that feel this strongly, it does send a strong message.
Great. So the next question asks about the definition of severe risk. I've been asking for 2 years since being diagnosed with end-stage kidney failure 2 years ago when COVID hit, and living in the bubble of fear because healthcare won't speak to the level of risk regarding the percentage of death rate, not to be specific, but sort of what is that range of what is risk? So obviously there's other comorbidities like age and transplant that play a factor, but how and why does kidney failure specifically put me at severe risk?
I honestly don't have a direct answer to that question. I can only defer to the experts at Health Canada who have put out there that kidney disease is on this list. And it's interesting because when I was just as confused when I was trying to find literature and information around kidney disease and the impact of COVID-19. I don't have the details on why and how the specifics of kidney disease itself would fall under that recommendation, along with all the other things on that list. Maybe, I don't know, GAIL, if you have anything you want to add to that.
Yeah, I guess we were working in a system where it was reactive to the data. And I think the one thing kidney patients across the province can be very reassured is the Ontario Renal Network, they collected robust data around what was happening with our patient populations. And why we were at the beginning saying it was very, there was extreme risk was because we were seeing outcomes similar to long-term care facilities when they were in outbreak and patient outcomes with patients in renal populations that would have outbreaks or get COVID. So we were extremely concerned about what that meant for our patient population, and not having the data because, this is new to all of us. It was something that we felt strongly that we needed to let patients know that there was a risk, and we were seeing this trend in our data that we were collecting in real time. So the data is there. You can ask your physicians to share it with you. It is available through the Ontario Renal Network. We've collected it robustly for 2 years in the hopes of being able to present it to people to understand what happened and, what our risks are going forward. And I think, that's probably your best person to ask. And I know I keep going back to that, but it really is. They've got all the information, but the ORN really did collect a lot of data for renal patients that did indicate, that there was that risk. It wasn't, being a little henny penny. It really was true risk for our patients. And it wasn't just dialysis patients, it was pre-dialysis. So really, I think going forward, we're going to have a better idea about that, but, have that discussion with your physician.
I just wanted to add that from a hospital experience, I can tell you that the first and second waves the waves pre the ability to vaccinate were way more significantly severe in the population. And then once people had the ability to be vaccinated, and we were very good with providing the opportunities to our kidney disease patients, we saw significant change in the morbidity and mortality associated with that. Less cases and less severe outcomes after the ability to vaccinate.
Right. So we're going back on the subject of masks. So is N95 still a recommended mask, or is cloth masks back okay?
So cloth masks are actually not recommended for protection. I would say at the very least you want a procedure or a surgical mask that's going to give you some good protection, and it's layered, so it's good. Neither myself or anyone in my family wears a cloth mask. The N95 is really more of a healthcare one that's worn in healthcare, but the KN95 has similar protection and I believe is available, online, etc. if you wanted to purchase one.
Right. And I think that really was nicely highlighted there, Vidya, in your tiered slide about the sort of the mask protection percentage, right? Sounds great. Are there any concerns of the vaccine and long-term effects on transplanted organs, possible rejection or effects on future transplants?
I would rather not comment on that. Definitely not an expert in that. GAIL?
Yeah, I'm going to say it again, and I feel a little bit like broken record, but I think if you have a transplant physician that you've been dealing with, they will provide you with the best information about that. I know that we've had some expert presentations to our renal teams through our regular renal regional calls. So they are well versed in the impact of that, but it's so individual depending on what medications you're taking, what stage your transplant's at, that I would really recommend looping back with your transplant physician.
Yeah, and I would concur with that, Gail. Transplant is such a unique specialty that the best bond is between you and your transplant physician for sure. So we've talked a lot about protections, but what metrics can we use moving forward to assess risk, or when can things go back to normal for us, but still being a little bit cautious? So I guess it's what's that long range milestones that should help to ease some of our social anxieties? Any thoughts?
So I think we're going back to the things that we look at. So right now I mentioned that in spite of the fact that we are reducing our public health measures in the community, there are certain parameters that are used to make those decisions. And so those parameters would be looked at to say, okay, we have a low community prevalence right now. It's much safer to remove your mask at a certain time. I don't know that there's one, percent positivity that's going to say, oh yeah, it's over. I don't think that that's the case. But right now, 13% positivity of our cases that we're testing versus 34% in January. In the past, we've looked at lower than 5% in considering, okay, it's no longer high. So I think it's those same parameters that we'd be monitoring moving forward to decide when it's safe to maybe reduce measures even further and feel more comfortable.
There we go, lots of stuff coming up. So we're getting close to the end of our Q&A session, so let's try and squeeze in a couple last ones here. So why is it higher risk to be around unvaccinated people if the vaccinated can still transmit the virus?
So I'm trying to understand the question. Why is it higher risk to be among unvaccinated? So an unvaccinated person is more likely to get COVID-19 than someone who is vaccinated. The people who are vaccinated are at risk of mild disease versus people who are unvaccinated who are at risk of more severe disease. So unfortunately, especially with the Omicron wave, it didn't protect everyone from mild disease. But the most important thing I want to emphasize is we need to be protected from severe disease, ICU admission, and death. And that's what the vaccination protects you from across the board. Mild disease, I'm triple vaccinated, and if I was to be completely honest, I believe I had Omicron back in December around Christmas time. And my disease was mild. I'm triple vaccinated. I got it anyway, but it could have been a different story if I wasn't vaccinated.
All right. And so we're going to close off this Q&A session where we first started with was that question around Evishield. So again, if you have questions about this new antibody treatment there, again, go back and consult with your healthcare professional, your provider. They are the source of knowledge for these things. So on that note, that does bring us in conclusion for this this session. I'd like to thank our fantastic speakers today, both Vidya and GAIL, for sharing their insights and their knowledge with us and being open to have this discussion. It's really, really beneficial, especially with the restrictions lifting and everybody getting back to their regular routines. So make sure to connect with your local hospitals and your renal team for any of these additional informations that you have further questions on. And please join our next session, which is Active Living in Kidney Health Movement. And this one starts in about 10 minutes, so around 10:30. Just to pre-warn you, there is some active movement during the session, and you're going to need a little bit of equipment to participate. So you've got a few minutes now to collect a few things. You need a stable chair, no stools, and no chairs with wheels. You're going to need a couple weights, maybe dumbbells or some tin cans of food or water bottles or something like that too, to work with, as well as a pillow or any average size ball. So also note participants can join by camera if they wish for this session with kinesiologist Monica Deluski to watch and support your movements as you're going through this session. So thank you again to our presenters, and please enjoy the rest of this day and all the other great speakers that are lined up.
Thank you.